This module is all about the patient experience flow. Now we're going to focus specifically on new patients, but it is very important that we realize every patient that comes into the practice, we need to make sure we are giving the same amount of focus to giving an exceptional experience. There's quite a bit that comes with this module, and it's so important that you do this within your first couple days of being in the practice. Some of this might not be new to you if you've worked in dental offices, but we really want to take some time to focus on the excitement and the experience that we create for our patients. You're going to be asked to observe multiple patient experiences start to finish, specifically 2 new patients within your first week in the practice. We have a new patient experience scorecard that's going to be rolled out that you will have a copy of to be able to assess how the new patient experience goes from start to finish at every interaction for that patient. You also have a worksheet that you should have printed. If you haven't, please pause this module and print the worksheet that is attached in this module so you can take great notes. This is something that you are going to be expected to scan in and discuss with your in-office leader, typically your office manager. And we want to hear your overall feedback. As you're watching this, I understand different parts tie into different roles in the practice differently, but please think about how each one of these interactions tie in to make the overall patient experience. We as a team need to know what those interactions look like from start to finish, so that way we can build off and better the patient experience instead of accidentally taking away the value that we intend to give the patient. So many things are happening before the patient even shows up for their new patient visit. First things first, they need to schedule their appointment. Here at Docs, we have a lot of different options for our patients to be able to get a hold of us to schedule their visit. They could always walk in, and we certainly get a lot of great foot traffic. We need to treat everybody coming into our practice as they are potential new patients and make sure that we set the tone and give a positive experience from the second that they walk in the door. Or if your office has glass and windows, we want to make sure that we are giving them a smile and a wave as they walk by so they know that we are accepting patients and we're happy to answer any questions that they have. Our patients can also schedule an appointment online. You'll see a snip of what the website looks like. There are 2 orange boxes that say schedule an appointment. It will take the patient to a spot on the website where all of our offices are listed, and they can pick which office is best for them, and they should be able to schedule an appointment. A side note to this, it is very important that our office team members, specifically the office manager and member coordinator, are checking this, if not daily, at least weekly. We have a monthly alert to remind the managers to do so, but you really should be monitoring this because every single day we have patients trying to make appointments, and we want to know that it is working properly and they're able to schedule online in a timely manner. Or patients can call us. Oftentimes, patients are calling us because they need something. They're in pain, or they're overdue on their appointments, or they just moved, they're trying to set up their care. So sometimes patients can be frustrated when they call. We need to make sure that we give them an exceptional experience over the phone. So when a patient calls or the phone rings in the practice and we don't know who's on the other line, we always need to make sure that we are answering the phone with positive energy and we are making sure we are smiling, in fact, because it comes through in the tone of our voice. So now that you know the main ways that patients make appointments, patients can also make appointments if we're working events in the community. Sometimes patients will just pop in or stop by and just basically feel us out without actually committing to schedule an appointment. And all of those interactions are extremely important. This is why we need to be mindful of many things about our practice. Is our lobby clean? Do we always have somebody up front who can be able to interact with anyone that stops in? It's very important that we set the tone not only for how we interact with the patient, but how they feel when they come in our practice. So think of all your senses. Are we providing an experience that is enjoyable for patients? Now, sometimes from the time the patient makes their appointment or schedules their appointment to the actual day of the appointment or when they're being seen, it can be quite a ways out. Urgency is key. Even if our patient is not experiencing any pain, if we don't do our best to offer them an appointment, I always like to say within 3 business days, but if we say within 1 week, then we're failing that patient. Now, that patient might not have the ability to come in sooner, but we need to make sure that we are offering an appointment. Now, I know sometimes things come up in the practice. You might not have doctor coverage if your doctor is out of the office for the week. Whatever specific need is in your practice, you can style flex and change this based off of your office's need, but we need to make sure that we are offering patients a sooner appointment. We also want to make sure that we notate in the patient chart that we talked to the patient, especially if they made their appointment online. We gathered all the necessary information, such as their insurance information, their chief complaint. We set the tone for what that initial visit looks like, which I will go more in depth on a little bit later in this presentation. And we are listening to everything that they are telling us. Sometimes it's not in what they say, but how they say it, or a lack of what they say that's going to give us some insight as to what the reasoning the patient is coming in or what they're hoping to expect. It's okay, and you'll learn depending on your role. Our goal is to train all the team members on how to do an effective confirmation call for our patients, but that new patient courtesy confirmation call is critical. We need to gather a lot of great data, so there will be a training that you'll be part of a little bit later for that, especially our member coordinators and our office managers. But we need to notate and document everything that we collect because we want to show that we are all in communication and we are valuing our patients' time. Speaking of new patient confirmation calls, each practice will have multiple copies of a new patient confirmation call sheet that is also linked in this module. I highly suggest that you put these in sleeve protectors so you can use a dry erase marker and then transfer all of the content into the patient's electronic chart. If you are in the United States, our software system is Denticon. If you are in Germany or one of our international locations, you guys use Open Dental. But the new patient confirmation calls should sound and look very similar. There's some key information that we need to be able to make sure that we gather. So first things first, when we call to confirm the new patient, you want to make sure you give yourself some time and you are at a station where somebody else is supporting the patients that are coming in or answering the phones on the first ring. And you want to make sure that you take the time to welcome the patient to the practice. Introduce yourself, give them your name and your position within the practice. You're going to want to gather their reason for the visit, or what we call their chief complaint. That could sound something as simple as, tell me what's bringing you in. Or, can you let me know what your expectations for the visit on next Tuesday at 2 p.m. are? Next, you want to make sure that you gather some important insurance information. Now, we have a third-party company that helps support putting all of our insurances into our system called DRG. Their requirement is that we have all the information put in the insurance portion of the patient chart, along with in the patient notes section, that is critical for them to be able to pull the insurance. So we know that includes, obviously we need to make sure the patient's name and birthday are accurate. We need to have the subscriber's given name or the name that would be on the insurance, their birthday and best contact information, along with what insurance they have or who their employer would be. And if they have that insurance card, we need all the numbers on the card. It is much better to type it all in and have it all and not have to call the patient a third or fourth time. But also let the patient know there is a chance that we may need to reach back out to you to be able to pull this information. Our goal is to have it all in so that way when you come in, we can be able to complete whatever treatment is needed that day and then go through a plan and be able to tell you and show you exactly what your insurance covers based off what our doctor diagnoses, and we can get a plan that works with you and your schedule to get you cared for. We need to make sure that we are very thorough in this, and we have to work ahead. DRG's cutoff is by 2 p.m. Eastern Time the day before. Now, should you have a new patient that schedules the same day, that's wonderful. That's great. We want to do that. We want to get patients in as soon as possible, but we are going to need to rely on the team in the office to gather the insurance information. In the event that you guys are short-staffed or you are not able to do so, we can always lean on a sister office or some of the support at our corporate office. So please lean on your area managers to help support you if need be. Next, we need to make sure that we are setting very specific expectations on what this appointment is going to look like. We'll cover this a little bit later in the presentation, but we also want to make sure we are listening and helping merge what the patient expects to how we handle our new patient flow. We need to make sure we're taking very detailed notes of what the patient's saying. Really listen to them and ask clarifying questions. Tell me more. Can you elaborate on that, please? What can I do to help set up the visit for success for you? This is why it is critical that you are in a place where you are able to focus on this call. And if you get a voicemail, you let the patient know that I would really appreciate if you could call me back. My name is, and I'm going to be here until, the best number to call me back at is. That way we can set up your chart and make sure that we meet your expectations for the visit. The more notes, the better. We're going to use these notes when we prepare at Huddle and to help for our handoffs. Our goal is to prevent making our patient repeat themselves multiple times. We always want to offer to see them sooner. Get the availability from the patient if something should open up, should they not be able to be seen in the next couple days, or if the available appointments don't align with their schedule. For every patient, we should have something in their notes on when they're typically able to be seen. We have patients that have very flexible schedules, whether they're retired or if they work from home and have more flexibility. And then we also have patients who have very difficult schedules. That's very important to note in the patient's chart because that's going to help when we're working on filling the schedule or offering to get patients in sooner. We always want to make sure to offer that we can see additional family members. We work on a military base. We see a lot of family members. So if we can offer to see multiple family members within one visit, that's going to make everybody's lives easier, and then everybody will be on the same dental timing for their recall visits. We're also going to explain what the new patient paperwork looks like and offer to email that ahead of time to the patient. I would say be very direct with your intent. We want our patients to complete this paperwork in advance. So if we do not have an email for the patient or they're not able to complete them virtually, try to see if they're willing to stop in, if they're going to be on base anytime soon, and if they could pick up that patient paperwork and have that done. At very minimum, please let them know if they cannot do it sooner and they're not able to come in, to please make sure they bring a copy of all current medications or medical procedures that they have had, because they're going to need to fill out a detailed medical form, and then have them arrive a minimum of 15 minutes early to their appointment. You want to be very clear about your verbiage there and let them know we need you to get here early. It takes on average about 15 minutes to complete your paperwork. If you tend to take a little bit longer or you have more of a detailed medical history or medications, you may want to arrive even sooner. We will do our best to get you back as soon as possible, but we want to make sure we can give you that full time with our doctor and our hygienist at the date of your appointment. So please make sure you arrive early. We're also going to want to make sure we confirm all contact information. We send a lot of text messages and email confirmations. We can send specific plan details or questions to the patient. Sometimes when you work in the practice, it's easier to virtually communicate. We can send custom text messages through Denticon. We can send emails to our patients. So we want to make sure that we know their best method of communication. We want to make sure we've got all the correct information. We want to repeat the spelling, repeat the phone number, have a backup phone number, just so that way we have all the correct details. Now, as you can tell, this call is probably pretty long. Plan on at least 15-20 minutes with the patient, and make sure at the start of the call you ask them, is this a good time to spend about 15 minutes so we can create your chart and be able to set expectations and gather alignment on what your hopes for your dental care is going to look like? They might be running out the door and would appreciate having the ability to be able to give you a call later or the next day and be able to actually take the time to focus to get you all the information that you need. Ideally, while you're on the phone with the patient, if you can get into the insurance portal, you'll want to make sure that you can find them in the system and pull up their insurance. You're going to want to always thank the patient anytime you're on the phone with them or they're in the practice. You want to thank them for coming in and for trusting us with their dental care. You're going to want to give them the office specific phone number so that they can call back if there are any questions prior to the start of their visit. You can ask them to save that number directly in their phone, and then that way they have it and they can get a hold of you guys. You can let them know that these phones are monitored from 8 a.m. to 5 p.m. Monday through Friday and from 8 a.m. to 2 p.m. on Saturdays. You can also let them know that we have an office emergency cell phone that is reserved for dental emergencies, but the phone number for the office will forward to the cell phone after hours, and the office managers are responsible for maintaining those phones after hours and then contacting the doctor should there be a true dental emergency. And then ask them to arrive early, like we said, just to finish up paperwork, finish anything that needs to be completed. Remind them that they'll need a copy of their medical list if that's something that they're not able to complete prior to the appointment. And just ask them for feedback, ask them for any questions they might have, and really get to know them in this quick phone call. This is something that many offices try to do but fall short. It's very important that we start and set the expectations very high and we're professional. It's going to set the tone for how the patients interact with us and how professional they are with us in maintaining their appointments. So now, just as a reminder, it is extremely important that everybody is aware that our new patients are very, very important to the success of our practice. This won't be the first time or the last time that you hear this. This is something we talk about regularly, but new patients are the lifeline of a practice. We need to be seeing at least 100 new patients a month, and that is per GP. So if you're in a practice that's a larger office or you have multiple doctors, we need to be seeing 100 new patients per month per full-time GP. If you have a part-time doctor that works 2 days a week, that's 2 out of the 5 days, we want to make sure that we are seeing an additional 20 new patients per month for those doctors, or 40 new patients per month for those doctors rather. Our whole company mission is to provide accessible, exceptional care to our military community. Without new patients, we're failing. We need to make sure that we understand we might see 8 new patients a day. We might have a huge new patient day and see 15 new patients per day. But for each one of those patients, that's their first visit in our practice. Just like if you're busy and you're making calls, you might answer the 50th phone call of the day. And if you're exhausted, it's the patient on the other line is going to feel that. We have to make sure that we take some deep breaths and we are answering every call and supporting every patient as if it is the very first appointment of the day, because for them it is. We only have one chance to make an exceptional first impression. We cannot waste it. It is so critical that we make sure we hit all of these moves and we set up the patient for an extremely successful new patient visit. Each interaction of the patient experience gets harder and harder to get them bought into care. If we really don't set ourselves up for success and we don't do a good job from the minute the patient walks in, it's very hard for that doctor to be able to connect with the patient and that consultant to be able to get the patient to commit to the treatment that we know they need, which our whole goal is to provide access to care. But we're also a business and we're not being successful if we're not getting patients scheduled and completing their care in a timely fashion. Just a reminder, that first impression in many, many cases happens before the new patient even steps into our office. Imagine how frustrated new patients would be if they try calling our practice during business hours and the voicemail's on, and then they don't get a call back that same day. Or ideally within the next 30 minutes, we need to keep an eye on that. Imagine the frustration of that patient if they're trying to make their appointment online and the link's not working. So it is the day of the patient's appointment. The patient arrives in the office, hopefully a little bit before the start of their appointment. Remember, we said please arrive at least 15 minutes early so we can get you checked in, confirm all your patient paperwork has been completed. But let's say that patient comes in and it's either right at the start of their appointment. They could be a little bit late. Maybe the line at the gate was long and it took them a while to get on base. Maybe they come running in with kids that are excited and running around, and you could tell the parent is a little bit stressed out. When the patient comes in, everything should stop and we need to make sure that we smile, wave, and greet the patient. We want our lobby and our desk up front to look clean, very minimal items out, we need to make sure that we are making an honest effort to walk around the lobby and look at it from a patient perspective. We might not see that dust bunny in the corner. We might not realize that the TV is off and we're just, we're so used to it being on and on low. We need to make sure that it's set up for comfort for our patient. We need to make sure that we greet the patient, we smile. Ideally, if we can deduct who that patient is, we want to greet them by name. We want to make sure that we are providing an exceptional first experience when the patient walks in. Take a second and think of the last couple appointments you've gone to, medical appointments. It doesn't have to be dental. Think about what the office looks like or what it looked like when you came in on your first day in the lobby. Think about your experiences. And then think of the image that you want your office to present. We are all part of the Docs family. Everybody who is on the team, we want you guys to feel empowered to speak up and let us know what we could be doing better for not only you guys as the team and the employees, but for the patients, for the community. So think of what the office looks like. What image does it present? This is a very realistic dental practice. There's people waiting, which we understand our offices can be busy. At any given point, there might be multiple people in the lobby. Are there seats for everybody? In this example, there's a gentleman standing. Maybe it's intentional, maybe it's not. Are the windows open? Are they inviting? Are there forms all over the lobby desk where it looks cluttered? Does the team member up front look extremely busy on multiple phones, running around? That is not the image we want to give. We need to make sure, now it's a fine line, we need to make sure we're busy and productive, but we also want to make sure that we are able to interact with the patient and give that sense of calm that our patients need. Patients are very scared to go to dental appointments. It's one of those things that we need to set ourselves up for success and provide a calm environment for them. There are a lot of critical steps that happen when the patient checks in for their visit. The receptionist, in our case member coordinator, office manager, in some cases cross-train or hybrid dental assistants, everybody in the practice should be able to check in a patient, whether it's a new patient or an existing patient. But typically it's the member coordinator or the office manager who's up front. They need to confirm that all the new patient paperwork is completed and accurate. If not, they need to give the patient the office iPad or a clipboard with the paperwork to complete. They need to update Denticon with any changes. Now, the clinical team should be updating the medical history in the back, but talk to your doctors. It's very important that the whole team is aware if there are anything that comes up on the medical history that they would need to know prior to bringing the patient back. Now, anytime we're talking about any medical history, it needs to be done in the back, but it might prevent them from starting with x-rays right away and moving the patient into an operatory and sitting down for some privacy to have that conversation. So it's very important that the member coordinator or manager is aware of anything that could potentially come up as a red flag and communicate that with the team. But they also have to remain very professional and they have to be mindful about what they're saying, how loud they're saying it, and that there are no patients in the lobby that can hear. We also need to make sure that we're notifying the clinical team as soon as the patient arrives, and when we put their router up, their router should have a patient indicator explaining something that's a noticeable feature or item that that patient might be wearing, whether they're wearing green glasses or a yellow sweater, something that will identify that patient to make it easier for the assistant or the hygienist to grab that patient from the lobby. We also need to make sure that their insurance is in and in accurately. Ideally, we already gathered this and DRG has put it in and everything is smooth sailing, but we definitely want to take a look and make sure, does this look accurate? Does the fee schedule look accurate? We can reach out to Amanda Taylor and her team if there are any questions or something doesn't seem right, but the sooner we catch this, the better, because the patient's going to be in the back for about 30 minutes. So we want to give our team some time to be able to take a look and be able to make sure we're as accurate as possible for the patient. You as the member coordinator or team member who's in that captain's chair, that's that main chair up front, the check-in chair, are responsible for observing and interacting with patients. If a patient is waiting beyond their start of their appointment, they need to be notified of delays. We should not be pushing blame on anybody for the delay, but we need to communicate what's going on. We also need to be mindful. Even though the patient's appointment, let's say, starts at 11:30, if they showed up at 10 o'clock, we could do our best to try to work them back and let them know, thank you, you're so early for your visit. Let's get you all set. If you would like, you could have a seat. We're going to do our best to work you back. But if they're sitting there staring at you and it's been 45 minutes, but it's still not the start of their visit time, make sure you acknowledge them and say, hey, we appreciate you so much coming a little bit early. I don't think we're going to be able to get you back. There are other patients that are back there. You are welcome to wait here. Would you like me to change the music in the lobby on the TV? Try to make them as comfortable as possible. You can let them know they're able, if they'd like to go grab something from the food court, you can provide them with a toothbrush and toothpaste if they were to eat and they wanted to brush their teeth. Let them know we have a restroom that's private, that's in the back. It's right down the hall if you need to use the restroom. Otherwise, you're welcome to step out and use the public restroom in the exchange. But we need to make sure we're in communication with them consistently. Even if it's just eye contact, a smile, a wave, let me go check and see how they're doing. Get up from your desk. If you know that the doctor and the assistant, maybe we know we're short-staffed for the day, they're in the middle of a root canal, they're not coming out, you don't need to pop in the operatory and say, hey, how much longer? We've got a new patient. But you should still get up from the front, make it look like you're going to the back, grab a drink in the break room, come back up and say, they're still with the patient before you. I know we're still a little ahead your appointment time, but I did want to check and see where we're at. The patient always should be welcomed with a smile, a wave, and some form of small talk. How's your morning going? Did you have a nice weekend? Find the things that are natural for you. It doesn't have to be a 30-minute conversation. In fact, it shouldn't be. We want to make sure that we're staying mindful of all the million tasks we all have to do on a daily basis, but we do want to make sure we welcome the patient and we help support them so they feel comfortable, like they can open up to us. If it is a reoccurring patient, that is the perfect time when you have some downtime to make sure their next appointments are scheduled. Ask if they had any financial questions. If your note from the last visit said that they were, thinking about using the care credit to be able to pay for Invisalign, that's the perfect time to say, hey, it's probably going to be another 10 minutes before the doctor comes back. Our office manager or treatment coordinator is available. Are you able to go sit and talk with them? I know you expressed that you were interested in maybe starting Invisalign and talking about some payment options. It's the perfect time. We always need to be reading through the patient notes and familiarizing ourselves, ideally before the patient even comes in, but when we check them in at the latest. As all this is happening, the dental assistant should be getting the room ready and set for the patient. When we bring the patient back, the room needs to be fully stocked with the appropriate supplies. Dentacon needs to be pulled up and loaded for the patient. Now you can minimize it so it's not up if anyone were to walk by, but it needs to be up and ready. And then the Nomad or the DigiDocs, depending on what type of X-ray units you have in your practice, should be in the room ready to go for their individual images and bite wings. And we want to make sure that we have the ray scan ready to go for their panoramic x-ray should they need a panoramic x-ray at the start of the visit. Each doctor has their own standing orders, so you will know what your office flow looks like and what x-rays your doctor requires for patients. Please remember, if it comes down to it and the patient is not eligible for x-rays, we can always get the x-rays from the prior doctor, but most of the time our dentists are going to want their own x-rays that are electronic where they can zoom in, look at everything, and it's saved in the patient charts. We own our x-ray equipment. Everything is electronic. We can always put the code in or adjust the cost of the x-ray at the date of that visit, so that way the x-rays are no charge to the patient. We want to get all the information we need to properly diagnose that patient. Most of the time, the only holdback from patients will be financial. It won't be anything to do with the radiation. You can cross those barriers if those come up. But we want to make sure we're doing all we can to set the patient up for success and establish that patient correctly. So use that to your advantage when you're going through the flow of the new patient appointment. We can always adjust the x-rays. Please make a note if you are the assistant or you are the member coordinator and the patient asks and says they don't think they're eligible. Note that we agreed that we would do the x-rays at no charge for them this one time to establish them. That way, in case later down the road the insurance does kick back that x-ray, then we can know that it was discussed with the patient and we can write that amount off. Now that already sounds like a lot. There is so much that goes into this patient visit, and our patient hasn't even left the lobby yet. So we haven't gotten into anything clinical, anything that could be scary for the patient. So if we really haven't set the tone and really set ourselves up for success, we're going to make it very hard to get the patient the care they need. So we need to make sure we are on top of it. Now, when the dental assistant or the hygienist, depending on the flow of your practice, gets the patient or retrieves the patient from the lobby to start the appointment, we need to make sure we are not cattle calling. What that means is you open the door or you go through the hallway to the lobby and the team member stands there and hollers the patient's name. Mr. Smith, Susie. We cannot do that. We want to make sure that we use that identifier, and ideally our lobby shouldn't be that busy. We should have some type of photo on any existing patient so we would know who our new patient is, and we want to go gather that patient. Go up to them. Introduce yourself first. Hi, my name is Allie. I'm your dental assistant today. I'm going to bring you back with me now. Is there anything I can grab you or I can get for you before we get going? Most of the time they're going to say no. They might say a joke and that'll open up small talk, but it makes them feel more welcome. You're going to want to kneel down a little, get eye to eye level with them. Guide them back. Walk with them like a friend, not like you're pulling them into the principal's office. Then once you cross into that clinical side, so you're out of the lobby, it is very important that we do that two-part patient identifier. Can you please confirm your first and last name for me? What is your birthday? What are the last 4 digits of your phone number? We need to make sure that we are identifying the patient. Our patients are military affiliated. They are used to this. They expect this. Now, before we are doing anything irreversible, now this isn't necessarily with the dental assistant, but we want to make sure we take a quick timeout procedure, which we'll go more in detail on what that looks like shortly. So this is your time to connect with your patient, save anything personal, like we said, until you get to the back. Do that two-part identifier. When you're in the back, you're going to want to review the patient's medical history, add it into the Denticon or Open Dental software. Let them know that we know the chief complaint already. They already told us. If we ask them for the 3rd time, what's bringing you in today? That is not going to sit well. So we want to guide the conversation and say, Ms. Smith, I see that you're having some sensitivity on your lower left. I am going to have to get some x-rays so the doctor can properly diagnose, but I'm going to do my best to be as sensitive as I can and keep you as comfortable as possible in this process. Is there anything else going on that you'd like me to note for the doctor? You're going to want to let them know what's going to happen before you do it. The kicker is, if you are taking x-rays, and a lot of our seasoned assistants know this, control the conversation so you are doing the talking while you're placing the sensor. It's going to keep you moving. If you have a chatty Cathy patient, they might control the conversation and it's hard to take those x-rays because you can't put a sensor in when the patient's talking. So use your flow. Part of why we're going to have everybody observe 2 new patient experiences start to finish is because we can see and customize our own interactions based off the things we're seeing that are great and some of the things we do a little differently. We want to create a culture in every practice where we can help coach and provide feedback to everybody. You will know exactly what your doctor requires you to do and take for all of our patients, x-ray wise and vital wise, but it's very important that we make sure we are gathering all the necessary information and putting it in the doctor's notes. There are note templates in Denticon. You should pull that up as an assistant and start filling it in. As your doctor is going through and diagnosing treatment, you need to be very thoughtful of what you are doing and documenting all the treatment that they are saying, anything that needs to go in the chart and in the software. If you are a little slower or newer to the software, you can always use the back of the router to handwrite everything and then transfer it into the computer until you can do it all at once. Our goal is to be as paperless as possible, so we want to make sure that we are using all the tools that we have. Speaking of tools, one of the most important tools that we have is actually something that we do in all of our offices. And I'm going to be honest, I've worked in many practices, large DSOs, private practices, in docs' offices. One of the first things to go when you have a stressed schedule or a short staff is handoffs. Handoffs are absolutely essential. They make or break how successful and impactful a visit is for our patients. And in turn, that makes or breaks how successful we are as an office. It is critical that we take the time to do successful, positive, detailed handoffs. They're going to feel like second nature as soon as you get in the swing of things, but it's so important to stressing the urgency and making sure everybody is on the same page for treatment. They need to be done in front of our patients. Our patients expect to have some sense of ability to partner in their care. They want to be a part of their dental care. Exceptional medical care is constantly evolving, and patients being connected in their care and having very high expectations is the new normal. So a handoff's not only a mix of what you say, but it's how you say it and how you connect with the patient. It's how you build up the next team member and how you can pre-communicate to the patient that we already know what you told us and we've communicated. We have our ducks in a row. We are building comfort in our office, we are building trust in our office, and we are helping the patient feel valued. Patients need to be fully bought in and committed to their care to help alleviate the stresses that we see and feel every single day in a practice. Anybody who's taken this module has probably already worked in a dental office before, and there are days and seasons in every practice where things can get stressful. Schedules fall apart, patients are frustrated, lots of no-shows, last-minute cancellations, staffing turnover. Handoffs will be the answer to all of this. It is connected in some way. So please make sure that in all of these interactions, we are doing proper handoffs. So just like the dental assistant, when they do all their preliminary items, now ideally if the doctor is available, they're going to be looking at the x-rays as they come up in their, if they have an office or in one of the operatories. The team needs to all be in communication of where the patient is within that visit. Utilize the colors on Denticon to indicate where the patient is. You want to give your doctor a heads up if you are going to be, if you're at a point where you can step away from the patient as the dental assistant and say, hey doc, I'm going to be ready for you in about 5 minutes in operatory 3. We've got Susie, the new patient. In her notes, there's a lot of great detail. I know we talked about her in huddle. Everything seems to be accurate that's in the notes. But it's very important we communicate. And then when the doctor comes in, introduce the doctor. Hi, Susie. I'm so excited to introduce you to Dr. Jones. Dr. Jones has been with us now for a little over a year. He is absolutely fantastic. Patients love Dr. Jones. He already knows you're having some sensitivity on the lower left, but he's going to take a look there, get an idea what we need to do to get you comfortable, but also that full comprehensive exam so we know how to get you completely healthy. Dr. Jones, this is Susie. We've had such a great time getting to know each other. Go ahead, I'll let you guys take it over. I'll be right here to chart and put notes in for you guys and help with anything you need. It sets the tone. And then the doctor is going to do the same handoff with the hygienist, or if the hygienist comes in first, the assistant does it with the hygienist, then the hygienist does it with the doctor. The assistant is that go-to utility player. They can always come back in and do the handoff if the hygienist has to get back to a patient and the doctor's not ready yet. We can always break it up that way, but it needs to be as natural as possible. So in a perfect world, the dental assistant would bring the patient back. The hygienist would then come in after the dental assistant has updated the medical history, done all the required x-rays and vitals, gone through expectations, and the hygienist would introduce themselves, perio chart, and talk about the hygiene that the patient needs. We also want to do as much same-day hygiene as possible. If your hygienist schedule is booked solid and your doctor is willing to do hygiene if their schedule is allowing, that is a great use of time if there's nothing else that we could put in the doctor's schedule. We also want to use our dental assistants so that way the hygienist can run 2 to 3 columns. So we need to make sure that our dental assistants are assisting all things dental. They are not just dentist assistants. Some offices have hygiene assistants depending on the makeup of the practice. So you know your team and the flow, and it's very important you guys talk about how we can continue to adjust and adapt our flow to be able to take care of more patients and make the appointments run as smooth as possible. But there's something so magical about the connection that a hygienist and their patients have. Hygienists keep patients coming back. They are the ones that the patient really bonds with. After the dental assistant or the hygienist, depending on the flow in the office, takes all the x-rays, does the vitals, reviews the health history, does all of the get to know you piece, and then they will perio chart the patient. So the hygienist perio charts the patient. The clinical team in the practice should have an idea on how they go about the flow, but ultimately it's the doctor that's diagnosing hygiene. So the hygienist perio charts makes their recommendation for treatment. The doctor needs to give the green light that yes, this is in fact the treatment that we are going to move forward with, and I am diagnosing that this patient needs a prophy, or this patient needs gingivitis treatment, or this patient does have active periodontal disease and will require scaling and root planing. We need to make sure we're using the same verbiage. Now, if we determine that the order of completing appointments for the doctor is as follows: get out of any severe pain, complete all hygiene, and then move into, most urgent to least urgent doctor needs, then we would want to make sure we try to do as much same-day hygiene as possible. Ideally, all of our patients should have hygiene done in their first visit. Gets a little more complicated if they're thinking that they're coming in for preventative prophylaxis or cleaning, as our patients call it, and they're diagnosed with needing scaling and root planing or having active periodontal disease. That's where we need to get the doctor involved. The hygienist needs to very clearly explain what those numbers from the perio chart mean, what they're seeing in the x-rays. If we have an iTero in the practice, which a lot of our offices do, we want to do a dental health scan so we can educate the patient on what they're seeing in the mouth. Picture says 1,000 words. For someone non-clinical, which is majority of our patients, they're not able to read x-rays. Even if you're trying to show them shadowing and bone loss, they're not going to see it like you would as a clinical team member. So having that iTero image is huge. We also want to make sure that we are taking intraoral camera images. So all of our offices have intraoral cameras. We can also utilize our office cell phone or iPad to take images to put into the patient's chart, but that's going to help us be able to educate our patient. And then we're going to need to get our treatment coordinator or office manager involved, because oftentimes those more in-depth hygiene appointments, which if we could do same day, that would be amazing, but we need to make sure that the patient is aware of their financial commitments to this appointment. And if they are fully aware and understand the severity of the clinical diagnosis and what that means if they don't get the treatment done, then odds are they're going to want to do it same day. We need to commit as a team that any periodontal patients, whether it's full-blown scaling and root planing, all four quads, 4+ teeth, or if it's even just one quad, we need to make a commitment that we are able to get our patients in within 3 days. Now, if the patient can't come in, that's one thing, and we want to notate it, but we need to make a point to try to get our patients in as soon as possible. So in order to get all these systems in place and know our structure, we need to communicate as a team. If you're watching this, you're probably either a new hire or we've just rolled this out and everybody is getting this module, but it's very important we spend some time talking as a team. These are things you're going to want to cover in your monthly office meeting. We should have time delegated in the schedule to get together and do a monthly office meeting. We're going to run and review things like emergencies and how we handle that, but everybody needs to be on the same page of what the flow looks like and what our doctor's expectations for certain things are, such as standing orders, how we handle new patients. Are we able to start hygiene before the doctor comes in if everybody's in alignment with what the treatment is? And don't forget, just like with the dental assistant, the hygienist and the doctor also need to be doing that 2-part patient identifier and a timeout procedure if we're doing any type of irreversible treatment. If you have any questions on what those are, please do not hesitate to reach out to our compliance team. But when the doctor comes in, they are doing a lot of things that they are not even saying they are doing. Aside from inspecting and getting to know their patient and doing an evaluation and an exam, they are also building trust and establishing a long-term care relationship. So it's very important that we give the doctor the ability to open up a little bit about themselves and their dental philosophy. A great tool is to explain to the patient why you became a dentist. What do you love about what you do every day? Humanize yourself a little bit more, because a lot of times patients are terrified of the dentist. Even though I know, because I've worked in dental for so long, our dentists are some of the most kindest, wonderful people that I've ever worked with. So it's very important that we take some time to get to know our patients and let them get to know us. You also want to make sure that you are explaining everything that is needed, why it is needed, and how soon you want to see them back. Urgency is key. If you tell the patient, well, we'll see you back when we see you, they're not going to be as urgent to make that appointment, and that's going to be a lot harder on your office manager. And when you're frustrated if your schedules aren't full, that could be part of the reason. So we got to stress urgency. We also need to make sure that we are educating the patient of the risk of not getting the treatment done in a timely manner. As someone who's spent most of my career as a treatment coordinator or office manager or handling patient satisfaction issues, I hear more often than I would like, I didn't know that it was going to get this bad. Or if you knew my concern was cost, how come no one told me that as it got worse, it was going to get more expensive? Dental is just like anything medical, doesn't just heal itself. The longer you wait, the more expensive it gets. We've got plans to help support you. So as a doctor, you're going to want to ask your patient, do you have any further clinical questions? Your handoff is going to be introducing your treatment coordinator or your manager. In a perfect world, they're the ones that are charting with you. So when you come in the room or when you're about to come in the room, if the office manager or the treatment coordinator is available to come in and chart, that's when the assistant should go grab them and say, hey, doc's going in with the new patient. It'll make the consult that much smoother. It's going to be very aligned, and then we can get the patient back in your chair for hopefully same day care. We want to do as much same day as possible, especially in the offices where your schedule absolutely allows it. But you've got to build up the team. Next is your consulter. Build up that consulter. Hey, Miss Smith, I'm so excited. I know that you're nervous about this work. The hard part's over. You came in. We can get you taken care of. I'm confident in that. Do you have any other clinical questions for me before I grab Joe? He's our treatment coordinator and office manager. He's phenomenal. He's the guy that's going to go over your insurance, go over payment options for you, and get you scheduled. I'd love to see you back today. I know I've got some time open in my schedule. We got to get these 2 teeth on the bottom left taken care of. These are the ones that were causing you pain. Is there anything else I can do for you before I grab Joe or before Joe takes over if Joe's been in the room charting? It allows the patient to ask any clinical questions so that way Joe can dive right in. Let's be real, we don't want our consultants or our treatment coordinators being the one to explain clinical. But the hard part is the patients usually are fully on board, but it's when they see the cost, that's when they start to get some other questions. So this is why you're going to want to be available in case the patient needs you to come back in. But if your consulter's right there, they can start the consult right in the operatory, especially if we don't have other patients waiting for the room, if we're hoping to do same day care, and if we don't have a treatment coordinating room. Couple of our practices have a nice consult room, but to be honest, it's better to keep the patient in the chair if we can go through and get them scheduled. And if we have all of our ducks in a row and everything in order, that way we can get their care done and get a game plan for how to get them completely healthy. All right, the consultation. This is my favorite part of the new patient visit, and it's very important that we know who is our prime consulter. It should be the office manager, or if you have a designated treatment coordinator, but we always need to make sure we have some backup consulters in case that consulter is at lunch, off, or with another patient. We don't want to keep patients waiting. Now, if let's say the main consulter is wrapping up with the patient and the next patient has a very extensive treatment plan, then we can ask them to wait just a couple minutes, but we want to make sure that we set ourselves up for success, and the consult is where we really get that commitment to treatment and get as much scheduled as possible. So the consulter has a really tough job. If everything was done correctly leading up to this point, it's far less difficult. But if we're having to pick up the pieces as the consulter and win that patient over while we're telling them how much their treatment is going to be, how long those visits are, and the potential pain they might experience from getting the work done, it's going to be tough. So we need to make sure that we are connecting with the patient, ideally elaborating off of connections that were already made. So I heard you really love going skiing. I love skiing. I was born and raised in northern Michigan. We love to ski. Make sure we present them with their full comprehensive plan. We need to be very clear on what is the best plan for them in their care. We cannot prejudge patients. We can't assume that a patient's not going to afford treatment or not going to commit to treatment. We certainly cannot be only showing them the most urgent thing, because that is not doing a service to them. We need to present them with a printout of their complete treatment plan. Even if some of it is going to take some time, we want them to see the exact treatment plan, what their full financial obligation is going to be. We're not trying to scare them. We're just trying to paint them the accurate picture. We also need to be able to read them. We have to say, is this something you've been preparing for or planning for, or is this kind of new and you weren't really sure what to anticipate? Let the patient talk. Give them some time to be able to tell you what's going on. This is where you ask things like, would a payment option make this a little bit easier for you to get completely healthy as soon as possible? The patient, you never know. The patient might say, well, hey, I've got an HSA and I've been saving for a little. This isn't so bad. It's a little more than I thought, but I know I've got to get it done. If we would have started and just told that patient that they only need to get one thing done, they would be missing out on getting completely healthy. And our goal is to get our patients entirely healthy. So they're just coming in for their routine 6-month hygiene or 3-month hygiene, depending on what hygiene they need. And then for their yearly exam or twice yearly exam, depending on how your doctor does it. We need to talk to them about scheduling and time frame. If we were in as the consulter with the doctor, we know when the doctor wants to see them back, that doctor has placed urgency. We want to get them back as soon as possible. We want to get creative. Odds are patients took time off that day if they are currently working, or if they're retired, they've got some flexibility. We know that we've got a food court. A lot of our offices have a bowling alley. There's the exchange, there's the commissary. The patients can run a couple errands and then come back. We know what our schedule looks like. How do we make the most of the fact that they're already there? And then that's going to get them bought in to continue to keep coming back. We know their insurance. We are in network and we accept their insurance. That is so rare these days, and that's part of the beauty of what we do and how we are at Docs. So we need to make sure we talk to them about that and we let them know this is great. Your insurance is going to cover this much of your treatment, plus it gets you an in-network discount because we are in network with your insurance. So we want to get them excited about the fact that they have good coverage, or they have coverage that we accept, because majority of private practices and even some large DSOs now are not accepting a lot of these insurances. And we need to make sure we ask them for feedback. How was your visit today? Did we meet your expectation? Was there anybody in particular that went above and beyond for you? That was my favorite question to ask as the office manager, because then usually the patient would say, oh, it was, whether it was the member coordinator, the dental assistant, the hygienist, the doctor. Sometimes it was me because I was the one that did the confirmation call. Then it would give me the in to say, well, you know what? We're running a contest within the company. If you could give us a 5-star review and mention that team member's name, when they're due for a raise or for promotion, they take those things into consideration. We'd really like to celebrate that as a team. So if you could take a minute, scan this QR code and give us a great review. Now the flip side is they might tell you some things you don't want to hear. Some of it maybe was in our control and we dropped the ball if they have some negative things to say. Some of it might be completely out of alignment for what we really could do in our practice and what we were offering for that first visit. But even still, we have to listen to our patients. We have to learn from all these things that we are hearing, and we might want to change how we do our courtesy calls. Typically, the person doing the consult should be the one doing those courtesy confirmation calls. This is your shot. This is your at bat. If you were the office manager, you should want to own this. This is going to help set your office up for success. So it's very important too that you break down treatment as needed. We don't want to start with broken down treatment. We can phase treatment and we can tell patients, look, these implants are going to take time. I know I want to get you the full breakdown so you're completely committed to it. Start to finish what this journey is going to be from, it could be a year. This is the time frame. This is what's going to be due at each step. But we do need to make sure that we give the patient their whole treatment plan and then whatever phases are needed. Listen to what the patient's saying, and you can style flex and you can get creative, but we are not doing a service to our patient if we are not discussing the fact that we do have financial options. Now, if a patient says, hey, I've got the money on my HSA card, or I've been saving, I'm just going to use my checking card, that's great. We don't need to go any more in detail if they're accepting full treatment. That's the best plan for our office. But if the patient is between I have only saved up, $1,000 and my treatment plan's $5,000, I'm just going to do the $1,000. We could talk to them about different treatment plan options to be able to get everything done by utilizing a financial plan, whether that's StarCard or Care Credit. There's deferred interest options. There's extended plans with lower monthly payments. So you want to make sure you talk to them. Make a joke out of it. If they're like, this is a lot of information, just say, hey, I wouldn't be doing my job if I didn't give you all the tools. I want to treat you as if you were my sister, if you were my brother, if you were my mom, you were my dad, you were my child. So whatever makes sense for you. I want to give you all the tools because we're here to support you. You have a say in your care. We're here to help get you taken care of. We understand. We fully believe in this treatment. That's the key. If you're in this practice, you believe in dentistry. We are in the dental field. We live and breathe by it. We know how necessary it is. A smile says 1,000 words. A smile is universal. Plus, hey, we eat with our teeth, right? We eat with our mouth. I don't know about you guys, but I love food. So we want our patients to be healthy and feeling good. So this consult is absolutely essential. A successful consult leaves with a patient with a signed treatment plan, a patient with financial commitment, ideally same-day care or care scheduled within the next couple days or at the patient's next available time, and the patient leaves happy, willing to give us a positive review. If any of these things are not aligned, we need to make sure we are addressing them and we have a follow-up plan that we commit to. It is also critical at the end of the day, or potentially at the huddle the next morning, depending on how your days go, we need to meet as a consulter with our clinicians, our doctors and our hygienists, and let them know how the new patients went from the day prior. Keep a new patient tracker. If you need that, we can provide that for you. But it is very important you talk to the team at huddle overall, just how it went, feedback you got, celebrate the wins, keep the opportunities generic and how everybody can benefit from it. Don't call one particular person out. You got to be smart about how you present it. But it is very important that as a team at the end of the day or the next day at huddle, we're talking about the new patients and then we're going more in detail from the clinicians and the office manager, the consulter. So if a patient said yes to treatment and they're scheduled, what went well? Did we talk about reviews and referrals? When are they scheduled to come back? Did we get other family members scheduled that same day when they're coming back? Feedback on any possible improvements from in our conversations with them, what all was accepted, anything not accepted, what's the game plan? And then if they don't accept, if they leave without making an appointment, without signing a treatment plan, what happened? What was the barrier that we couldn't break down? We might see some trends and we can use those trends to improve so that way we are better for our patients. It could be from the confirmation call, could be some step in the process, but we can learn from that. Did they leave with all their financial options? Did we break their treatment apart so they can see how we would divide it up? And then what's our follow-up plan? Do we have learning opportunities? Do we need clinical support for the follow-up? I told you guys this absolutely was not the first, last, and it won't be the last time that you guys see this in our presentations, but new patients are absolutely important. Remember, our mission is to be a recognized leader in expanding access to care around the world that impacts and improves health outcomes. So our monthly goal, we need to hit at least 100 new patients per full-time GP or full-time dentist in the practice. So if you have a doctor that works Monday through Fridays, that's about 22 working days per month. So if we need 100 new patients in 22 days, we need to see over 4.5 new patients per day. We know we can't see a half patient during the day, so we should be shooting for a minimum of 5. We also know that there's days where our doctor might get sick. There are days where we might have crazy weather or crazy situation that the office, might have to close. So we always want to round up. My rule of thumb, we should be seeing probably 7 new patients per day. So we got to get creative. We got to continue to move patients up and offer them an appointment within 3 days. We want to get their availability so we can better direct and our calls can have a purpose. Instead of saying, hey, you want to come in sooner? We have an opening today. It could sound something like, hey, Miss Smith, I know when we last talked last week, you're able to come in on Wednesdays for appointments. We didn't have anything available last Wednesday, but in doing my confirmation calls, we had two appointments that had to switch their visit. So we now have an appointment in the morning and the afternoon. Would one of those work for you? We would love to see you sooner. Our doctor is very excited to meet you. Even better if you say the doctor's name. Dr. Smith is so excited to meet you. It makes it more personal, but at least then it's more guided. It is so important that we are constantly evaluating the experience we are giving to our patients, especially our new patients. So now that you've learned all of this, please finish that worksheet, which you could have been filling out as we went, or take a few minutes, fill that out, and then you are responsible for reviewing 2 new patients start to finish this week. Ideally, do it today and follow that checklist that's on here. We want to see how we're doing. I want you to see all the different pieces that tie into a patient appointment and the new patient visit and getting that acceptance so the patients can get the care they need. Thank you so much for your time. We're so thankful that you're a part of the team and giving our patients an exceptional experience.